This presentation is presented by the Patient Advocate Certification Board. The title is Charting the Course of the Profession Through Credentialing and Standard Setting. This program has been pre-approved by the Patient Advocate Certification Board to provide continuing education credit to board-certified patient advocates. The course has been approved for a total of 1 CE contact hours. Approval number 18158-5. My name is Melissa Cardine, and I am the current president of the Patient Advocate Certification Board. I am also a practicing advocate through the Bridge RN Patient Advocates and an educator and mentor through the Bridge Health Advocates. I would like to start out with the Patient Advocate Certification Board's, or otherwise known as PACB's, core mission, which is to promote excellence in patient and health advocacy through credentialing and standard setting. We will talk more about credentialing further in this presentation. PACB is a 501c3 nonprofit with a mission to benefit the public by granting the Board Certified Patient Advocate, otherwise known as BCPA credential, to qualified candidates and to uphold the certification as the recognized standard of excellence for patient and health advocates. PACB acts in the public interest by fostering professional standards in patient and health advocacy through setting and enforcing education, examination, experience, ethics, and professional conduct requirements. So let's talk about why one would become a BCPA. BCPA certification is the only nationally recognized credential for professional patient health advocates. Certification helps to ensure that BCPAs have met the standards and competencies defined by the Patient Advocate Certification Board. Advocates holding the BCPA credential are subject to sanctions, including suspension or revocation of the BCPA mark if they violate the standards. Becoming a BCPA unites and elevates our profession of advocacy. Board certification translates to confidence and trust and is valued by consumers worldwide. We need more BCPAs out there sharing what we do. Passing the examination to become a board-certified patient advocate creates and promotes competence and professionalism in our field, along with formal recognition. We truly ensure patients have a voice in their care. What are the benefits to certification to our profession of advocacy? 1, it increases and improves visibility and stature of the profession within a larger industry. It improves understanding of the profession by related disciplines. It helps in the creation of academic programs and professional development programs. It helps avoid government regulation. Most importantly, it improves the visibility of the profession within the public. Earning the BCPA credential puts you in a special league, positioning you as a leader and role model in patient advocacy. Investing in BCPA certification is an investment in yourself and your long-term career. BCPA certification can help you improve your earning potential, open the door to more opportunities for career advancement, increase your job mobility and choices, reach not only your short-term goals, but also position yourself for success in your long-term career. It can provide a foundation of broad and deep understanding of patient advocacy. How does becoming a BCPA benefit employers? PAC Board certification represents a high level of achievement and demonstrates proficiency and a broad base of knowledge in patient advocacy. PAC Board certified professionals pass a rigorous exam and commit to ongoing professional development and recertification. Hiring PAC board certified individuals or investing in BCPA certification for your current employees can help increase the competence level of your staff, build a strong, dedicated team that is committed to high standards of care and quality, promote ongoing enhancement of knowledge and skills, improve the quality of information and care, minimize errors and reduce exposure to fraud and abuse charges, and increase efficiency and reduce costs. In the next few slides, I am going to go over the following terms: profession, professional, certification, certificate, licensure, and accreditation. What is a profession? A profession refers to individuals who earn their living by performing an activity that requires a certain level of education, skill, or training. There is typically a required standard of competency, knowledge, or education that must be demonstrated. They must adhere to a defined code of conduct and ethical standards. Certification is a comprehensive assessment of an individual's knowledge, skills and experience, and abilities based on a body of knowledge pertaining to a profession or occupation. In this case, we are talking about being an advocate. A certificate is different from certification in that it focuses on learning events and is based on completion of a defined coursework. So you receive a certificate after you complete a program. The words certificate and certification get confused by many. You receive a certificate for completing an advocacy course or program, which certifies you have taken that course or program. If you hold a certification, you must have met a certain criterion to become certified. For example, to become a board-certified patient advocate, you need to meet eligibility requirements and pass an examination. Licensure is a comprehensive assessment of an individual's knowledge, skills, and abilities based on a body of knowledge pertaining to a profession or occupation. It is typically regulated by the states and may be required to practice a specific profession. For example, a physician, nurse, attorney, accountant, all hold licenses to practice in their state. Usually, a state organization ensures one meets the requirements to become licensed, stay licensed, and can revoke licensure. Accreditation is a neutral third party's formal declaration that a certification program is developed, maintained, and administered in a way that meets relevant norms and standards. The Patient Advocate Certification Board is working toward becoming accredited by the Institute of Credentialing Excellence. There is a process for this. Our strategic priority is to conduct a comprehensive analysis of patient and health advocate roles to identify the domains of practice, to develop and validate the tasks, knowledge, skills, and abilities related to work performed by patient and health advocates, to utilize the findings for development of a competency framework and body of knowledge for the profession. So how do we do this? All professional organizations supporting specific professions or industries must continually seek to define roles and functions in a way that uses the evidence-based literature and knowledge from practice to identify the roles and functions of the profession. The information is then used to give guidance to the construction or revision of the body of knowledge. In fact, the establishment of a valid job analysis is essential to the integrity of a credentialing program and its associated exam. A job analysis is also known as a job task analysis, practice analysis, or role and function study. It is a research study designed to obtain descriptive information about the task performed in a job and the knowledge needed to adequately perform these tasks. In this case, we have collected data from advocates regarding the tasks they do as advocates. We just closed the collection of the data on August 31st. We used a survey to collect the data. The next step is to analyze the data we have collected. Why is this important? The job analysis translates practice into a usable format for test development and delineates the important tasks and knowledge deemed necessary for competent practice. In other words, a job analysis helps ensure that a certification exam is both job-related and has content validity. The job task analysis is the tool that links the content of the certification exam to field-identified important job tasks and is an essential component in establishing the content validity of a credentialing exam. We also want to ensure public protection, along with that entry-level practitioners have the competencies to be an advocate. I would like you to take the time to watch this video. It was aired on Vice News, and the title is Patient Advocates Can Save Your Money and Your Life. I'd like to back up a little and provide some history regarding the organization. In 2012, a steering committee was formed. These were the visionaries for the field of advocacy. In 2015, a 501c3 was formed. In 2016 and 17, a foundational exam was formed. The first exam was in March of 2018. In 2019 and 2020, we did an item analysis and updated the exam. In 2020, we implemented eligibility requirements. The current requirements are complete the self-assessment tool, provide 2 letters of recommendation, possess a bachelor's degree or higher, or equivalent experience with appropriate evidence. Also, in 2020, we established a certification commission. We then convened a panel of subject matter experts. These were advocates from various backgrounds that represent the demographics of our industry. They are experienced and active in the role of being a patient advocate. They have a great understanding of the position. The purpose of the PACB job analysis study is to identify and validate tasks and knowledge important in the work performed by patient advocates. The results of the study will be utilized to create test specifications that will guide the development of new versions of the BCPA exam. The study results will also serve as a framework for PACB regarding content selection of continuing education for recertification. We launched the JTA in early 2021 and just started analyzing the data and plan to publish the data later this year or early 2022. We also launched the first practice exam this summer. This is just the highlights of the work that has been done and we are doing. What are we going to do with all this data? It will help us with job descriptions, compensation, training, to name a few. It will help with the blueprint of examination, test development, and examination preparation materials. Here is some preliminary data from what we have collected. We looked at where do patient and health advocates work. 9% work at an organization that serves a specific population. 9% work as a consultant or work at a consulting firm. 16% work at a medical firm, i.e. a hospital, rehab center. 27% work at a private business. 28% are solo entrepreneurs who own their own advocacy business. The 10% work in other areas like academic institutions, employee assistance programs, insurance, military VA, and research. Here are the top areas of practice for patient health advocates. They work in the areas of decision support, care management, work with the elder, geriatrics, transitions of care from, say, hospitals to rehab to home. They work in the field of insurance, mental behavioral health services. They assist in ethics, medical guidance, cancer, patient safety, billing, neurological dementia, end-of-life care. They work with the uninsured, rare diseases, and life care management. There are almost 900 board-certified patient advocates. It is very exciting to see BCPAs in the news. Advocacy is a rapidly emerging and evolving field. It is a rare opportunity to see a profession unfold like this. PACB strives to have patient advocacy recognized as a professional practice. As an advocate, you can share with others the work you do to shape the future of our profession. Please take the time to read these articles by BCPAs. What is the role of an advocate? Advocates work with clients who need assistance navigating complex medical, behavioral, or insurance financial situations by partnering with them and supporting their ability to make individual and well-informed decisions. Advocates strive to uphold the legal and ethical principles of voluntary, informed, and understanding consent, as well as those of shared decision-making between patients and providers. They do so by ensuring clients have the relevant information, an appropriate understanding of the matters in question, are not being coerced. Advocates make sure the client's voice and choices are heard. At no time do advocates make decisions or recommendations regarding specific treatment choices, provide clinical opinions, or perform medical care of any type, even if they possess clinical training or credentials. The PACB publicly released documents are the products of countless hours of volunteer work by a diverse group of board members, task force members, practitioners, educators, and professionals, drawing on numerous sources as well as their own professional experiences. The PACB employs a careful and deliberative process that involves research, discussion, drafting, review, editing, critique, posting for public comment, revision, clarification, final editing, and posting of information. PACB's ethical standards, competencies, and best practices are the product of an evolutionary process that continuously builds upon the work of our predecessors. The field of patient advocacy is indebted to many individuals and organizations that built the foundations of the profession of patient health advocacy. Their insightful and pioneering work in crafting some of the initial principles and standards of patient advocacy has guided, inspired, and provided a basis for PACB's independent efforts. Special reliance has been placed upon the seminal and groundbreaking work of the National Association of Healthcare Advocacy Consultants, the late H. Kenneth Schuler, and the Alliance of Professional Health Advocates, to whom PACB expresses its sincere gratitude. The following are the ethical standards from the Patient Advocate Certification Board for the patient advocacy profession. The Patient Advocate Certification Board is an organization of professionals, including, but not limited to, healthcare and patient advocates, patient navigators, case managers, and others who work on behalf of patients, communities, and family caregivers who share the goal of safe, effective, and compassionate healthcare. Board-certified patient advocates work with individual clients who need assistance navigating complex medical situations by partnering with them, seeking to empower them and support their ability to make autonomous decisions. Advocacy is a dynamic and developing field. Over time, these ethical standards may be revised. The Patient Advocate Certification Board welcomes questions, comments, and concerns about the standards or their implementation in professional practice. Advocates are committed to integrity and transparency in the conduct of their practices. They develop clear client expectations related to their scope of practice. Advocates have a responsibility to ensure clients are fully aware of all conflicts of interest that might result from their conditions of employment. Advocates providing fee-for-service assistance have an obligation to disclose their fees, training, education, experience, and credentials. They must disclose existing contractual relationships with manufacturers or distributors of products or providers of services they recommend or use to assist their clients. Advocates providing fee-for-service assistance are obligated to present their clients with service agreements that clearly define their scope of practice, fee schedule, and terms. Advocates provide the client the projected length and scope of the relationship, keeping in mind criteria for appropriate termination of that relationship. Advocates respect each client's right to privacy and abide by all relevant laws and regulations as they pertain to the confidentiality of records and personal identifiable information. Advocates shall at all times safeguard and protect the confidentiality of all medical records and the identity of and communications with their clients. Advocates shall treat all clients with compassion and respect. They will honor their clients' personal values concerning care and the right to be involved in all decisions that affect the client's care. Advocates are dedicated to promoting their clients' right to exercise autonomous decision-making and meaningful, informed consent. They strive to ensure their clients are fully aware of and understand all care and treatment options, including potential risks, benefits, and available alternatives. Advocates will attempt to provide clients with complete information to facilitate informed decision-making. Advocates have a responsibility to inform clients of their specific areas of proficiency and only to assist clients within those areas in which they have demonstrated expertise. If a client needs assistance in an area which an advocate does not have sufficient knowledge or training, the advocate is obligated to refer the client to the appropriate system or resource for assistance. Advocates shall not accept any compensation for making referrals to other providers or services, nor steer clients to products or services from which the advocates will profit financially or earn a commission. Essential to the profession of advocacy is the belief that equal access to appropriate health care and treatment is the right of each individual. Advocates are committed to assisting clients of all cultural and ethnic backgrounds. They shall be mindful of the cultural context of medicine and each client's cultural context by respecting individual perspectives. When unfamiliar with a client's ethnic or cultural background, advocates will work to understand preferences and to include that regard into the provision of the client's health care. Advocates are committed to lifelong learning to keep their knowledge and skills current, hone their professional expertise, and keep abreast of current conditions and the rapidly changing healthcare environment. Advocates participate in the continued learning of their colleagues by sharing information and resources for the benefit of the profession and the public. The Patient Advocate Certification Board recognizes the importance of competencies and best practices as a guideline for professional practice in the field of patient advocacy and for development of an assessment process for certification. Let's take a deeper dive into the domains of patient advocacy. The first domain is scope of practice and transparency. Patient advocates will provide to potential clients clear, accurate, and complete information about training, education, experience, credentials, and limitations, as well as any possible fees and areas of potential conflict of interest. They will inform clients about the limits of their scope of practice and advise clients strictly within their defined area of proficiency. They will obtain, maintain, and protect the privacy of any and all medical records required to serve the client's needs. They will avoid making any decisions for or on behalf of a client, avoid diagnosing or prescribing any medical, mental health treatment for clients, even if the advocate has additional licensure or training. They will refer clients to qualified alternate professionals if a client's needs are outside the scope of the advocate's knowledge or training. They will provide a written service agreement to each guarantor and client, both paid and pro bono, that clearly sets forth the nature and scope of services, fee schedule, terms, projected length of the relationship, and the criteria for appropriate termination of the relationship. Patient advocates will treat clients fairly. They will promote equitable access to appropriate and safe healthcare and treatment, respect the rights of clients to make their own decisions, provide clients with information and resources to facilitate informed decision-making regarding care and treatment, including palliative and end-of-life care. They will assist clients in understanding care and treatment options, including potential risks, benefits, and available alternatives. Patient advocates will provide empathetic, non-judgmental, supportive listening and interactions that promote self-determination, well-being, resilience, and confidence. They will collaborate effectively with other members of the healthcare team, both in and out of the hospital, to ensure appropriate and compassionate care for the client. They will include the family and caregivers in the client's planning process according to the client's wishes. They will provide any information, written or documentation requested by the client in a timely, appropriate, and professional manner. They will utilize basic conflict management skills and interactions between the client and family, health professionals, or other relevant stakeholders. Looking at healthcare access, finance, and management. The patient advocate will understand and be able to communicate generally how the healthcare system functions and the roles, responsibilities, barriers, and constraints of patients, payers, and providers within the system. They will facilitate the client's navigation through the complexities of the healthcare system continuum, clarify care transitions, and assist clients in appropriate aspects of these changes. Comprehend and apply the fundamentals of prescription, drug costs, and coverage for all clients. Recognizing barriers to care coordination and work with clients and providers to overcome them, requesting provider-to-provider conversations and other client-focused collaboration as required. Understand and communicate to the client the basics of health insurance, Medicare, Medicaid, and other programs that affect payments for the client's medical needs, including appropriate state variations and differences amongst programs. Gain fluency in basic medical bill interpretation and apply the general provisions of insurance coverage to each client situation. Integrate community-based resources to support and sustain the client's well-being. Utilize appropriate grievance, appeals, and complaint processes. Patient advocates will maintain familiarity with basic medical terminology, major life-threatening illnesses, and chronic diseases. Explain the structure and functionality of healthcare facilities and provider groups to clients and expose resources available through each system, Access the full range of healthcare providers and delivery care models and enable second opinion options. Assist clients to coordinate care among many clinicians, settings, and affiliated providers. Conduct research to uncover detailed and reliable medical information relevant to each client. Promote safe care and the patient's awareness of patient safety issues at all times. Professionalism, professional development, and practice. Patient advocates will assess the client relationship on a regular basis, continue to recognize, develop, and maintain professional boundaries as defined and the ethical standards for a board-certified patient advocate, and avoid situations that may jeopardize these boundaries. Maintain, update, and provide proof when required of all credentials, liability and business insurance, legal contracts, and other practice-related requirements. Continue to develop skills and maintain competence in all specific areas of expertise. Work within the scope of the BCPA credential and obtain continuing education credits as required. Keep abreast of laws, policies, research developments, and trends that affect the practice of patient advocacy. Take initiative to seek out colleagues, mentors, and other experts regarding challenging client situations. I hope by now you can see the amazing work that pioneers in advocacy started years ago and the work that is currently being done to elevate the profession of advocacy. Please take time to read these articles by BCPAs. In conclusion, the vision of the Patient Advocate Certification Board is board certification for all patient and health advocates. For more information, feel free to visit the PAC Board website or contact Danielle Marshall. Here are a list of the resources used in this presentation.